Welcome to the spoken tutorial on basics of newborn care. In this tutorial, we will learn how to handle a newborn, umbilical cord care, feeding and burping a newborn, diapering and diaper rash, and sleeping pattern of a newborn. The entire family gets excited upon the birth of a newborn, and everyone wants to see the baby and hold the baby. Therefore, it is necessary to set some key rules while handling a newborn baby. Newborns don't have a strong immune system. This makes them prone to infections. To protect the baby from infections, it is important to have clean hands before touching or holding the baby. To clean the hands, wash with soap and water and dry well using a clean dry cloth before holding the newborn. Now comes the first thing to learn, which is how to hold a baby. Hold the baby by supporting her head and neck with one hand and bottom with the other hand. To lay a baby down, always support the baby's head and neck and hold her bottom as well. On the other hand, to wake a sleeping baby up, do the following. Tickle the baby's feet or lift and support the baby in a sitting position or gently touch the baby's ear. Always remember that a newborn baby is sensitive. Some precautions to be taken while handling a newborn are: the newborn is not ready for rough play. Therefore, do not jiggle the baby on the knee or throw her in the air. Never shake the newborn, whether in play or in frustration. Avoid sudden jerky movements of the baby's neck. All these may cause internal injuries to the baby. We will now learn about umbilical cord care at home. When the baby is in the mother's womb, the umbilical cord is the baby's lifeline. However, it is no longer needed once the baby is born. Within a few minutes after birth, as soon as the cord stops pulsating, it is clamped. By the time the baby goes home from the hospital, the cord begins to dry and shrivel. The cord falls off by itself in about 1 to 2 weeks. Please note that the umbilical cord may be a place for infection to enter the baby's body. Hence, it is essential to take care of it properly. For that, please remember, baby's cord should be kept dry and exposed to air. Only sponge baths should be given until the cord falls off. The cord should be kept on the outside of the baby's nappy or can also be folded down to the top edge of the nappy. Please consult the baby's doctor if there is bleeding from the end of the cord or the area near the skin, pus, swelling or redness around the navel, signs that the navel area is painful to the baby, and if the cord has not fallen off by 1 month of age. Sometimes it might also happen that there may be a small amount of blood when the stump is about to fall off and also after the cord falls off, but this should be stopped quickly. Remember, never pull the cord off. Also, do not apply any cream or powder or tie any bandage on the baby's umbilicus after the cord has fallen. For the nutritional aspects of the newborn care, we will discuss how to feed the baby. The newborn should be breastfed within 1 hour after delivery. Exclusive breastfeeding is recommended for the first 6 months. Additionally, the mother should provide adequate skin-to-skin contact to the baby and observe the hunger cues of the baby. All these points have been discussed in other tutorials of the same series. In some cases, newborns may need to be awakened frequently so that they are fed enough, especially the smaller premature babies. In case a baby healthy or premature, does not seem to be interested in sucking, then the mother should consult the doctor or health worker. While breastfeeding, babies often swallow air which can make them fuzzy. To prevent this, make the baby sit and burp after every feed. It has been explained in another tutorial of the same series. Next is diapering. After each bowel movement, or if the cloth nappy is wet, lay the baby on her back and remove the dirty nappy. Use water and soft washcloth to gently clean and wipe the baby's genital area. Do not apply any soap on baby's genital area. Whenever wiping a girl, wipe her from front to back to avoid a urinary tract infection. The mother or caregiver should always thoroughly wash hands before and after changing the nappy. Sometimes it could happen that a baby may suffer from diaper rash. Diaper rash is a common concern. Typically, the rash is red and bumpy and will go away in a few days with warm baths, some diaper cream, and at times without any diaper or nappy on the genital area. Most rashes happen because the baby's skin is sensitive and becomes irritated by the wet nappy. To prevent or treat diaper rash, change the baby's nappy often, especially after bowel movements. Gently clean the area with a soft cloth and water. Avoid using wipes as sometimes this can be irritating. Apply a very thick layer of diaper rash or barrier cream. Creams with zinc oxide are preferred as they form a barrier against moisture. Wash the baby's nappy using dye and fragrance-free detergents. Let the baby stay without a diaper or a nappy for part of the day. This gives the skin a chance to air out. In case the diaper rash continues for more than 3 days or seems to be getting worse, please consult the doctor. It may be caused by a fungal infection that requires a prescription. In the end, let's discuss about baby's sleeping pattern. Babies sleep for around 14 to 16 hours or more in a day. Newborns typically sleep for a period of 2 to 4 hours. Many newborns have their days and nights mixed up. They tend to be awake and alert at night and sleepy during the day. One way to help them sleep more at night is to keep minimum stimulation at night. Example, keep the lights low by using a night lamp, and during the daytime, try to keep her awake a little longer by talking and playing with her. The mother or caregiver should remember that a baby should always be on her back while sleeping. This reduces the risk of sudden infant death syndrome. For other safe sleeping practices, avoid using the following items in their crib: blankets, quilts, sheepskins, stuffed toys, and pillows. All these can suffocate the baby. Also, be sure to alternate the position of the baby's head each night. First right, then left, and so on. This will prevent the development of flat spot on one side of the baby's head. This brings us to the end of this tutorial. Thanks for joining.